Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Classification. What is the classification of synovial fluid? Synovial fluid can be classified as a normal synovial fluid, non-inflammatory synovial fluid, inflammatory synovial fluid, or it can be classified as septic synovial fluid and hemorrhagic synovial fluid. So the differences between them is very important. First, we will see the classification. So, what are the things in normal synovial fluid, non-inflammatory synovial fluid, inflammatory synovial fluid, septic synovial fluid, and hemorrhagic synovial fluid. So, 1 minute. Okay. Right. We have normal synovial fluid, we have non-inflammatory synovial fluid, septic synovial fluid, and we have hemorrhagic synovial fluid. Right. Normal, inflammatory, septic, and hemorrhagic. Very good. First, in the normals, first we will see the volume. Okay, volume of normal synovial fluid is less than 3.5. Volume of non-inflammatory synovial fluid, volume of normal synovial fluid is less than 3.5. Okay, volume of non-inflammatory synovial fluid is more than 3.5. Volume of inflammatory synovial fluid is also more than 3.5. Volume of septic synovial fluid is also more than 3.5, and volume of hemorrhagic synovial fluid is more than 3.5. So volume of normal synovial fluid is less than 3.5, and the rest all types of synovial fluid it is more than 3.5. Then if you see the viscosity, viscosity of normal synovial fluid is high. Viscosity of non-inflammatory synovial fluid is also high. Viscosity of inflammatory synovial fluid is low. Viscosity of septic synovial fluid is mixed. Viscosity of hemorrhagic synovial fluid is low. Then we have clarity. Clarity of normal synovial fluid is clear. Clarity of non-inflammatory synovial fluid is clear. Clarity of inflammatory synovial fluid is cloudy because of inflammatory cells which are present. Clarity of septic synovial fluid is opaque. Clarity of hemorrhagic synovial fluid is mixed. Whereas color of normal synovial fluid is colorless or it is straw colored. Okay, normal synovial fluid it is either colorless or it is straw colored. Okay, normal synovial fluid. Then color of inflammatory non-inflammatory, first color of non-inflammatory synovial fluid is straw colored or it can be yellow colored, whereas color of inflammatory synovial fluid is yellow colored. Color of septic synovial fluid is again mixed, whereas hemorrhagic, because blood is red in color, it is red colored. Right. Next, after color, WBC per millimeter cube. Okay, WBC per millimeter cube is less than 200 in normal synovial fluid. In non-inflammatory synovial fluid, it is 200 to 2000, whereas in inflammatory synovial fluid, it is 2000 to 75,000. Okay, in inflammatory synovial fluid, it is almost 2000 to 75,000. In septic, there is inflammation, so it is even more, that is more than 1 lakh WBCs. Whereas in hemorrhagic, because in hemorrhagic there is blood is reaching, so it is almost same as that of blood. So the number of WBCs in hemorrhagic synovial fluid is same as that of blood. Next, then after WBCs we have uh, polymorphonuclear cells. Okay, polymorphonuclear cells, if you see the percentage of polymorphonuclear cells, it is less than 25% in normally, and in non-inflammatory also it is less than 25% because there is no infection. In inflammatory it is more than 50%, whereas in septic it is even more, so more than 75%, whereas in hemorrhagic it is almost same as blood. Then we have then if you do a gram stain, this gram stain in the normal it is negative. Obviously in non-inflammatory also it is negative. It is negative even in inflammatory also. The gram stain is negative, whereas in septic obviously it is due to a bacteria, so it will be positive often, and it is again negative. Even in the septic also it can be negative if it is due to a gram negative organism. If it is due to gram positive organism, then it will be positive. Then
Thank you and thank you for watching.